Okay, so here's a pretty common question that I'll get in one of the Facebook groups that I run. So we can kind of read through it. 36-year-old woman, very common for this kind of issue. So disc issues happen a lot to people in the 30 to 50 range. Now, it can be younger and it can be older, but this is very common. Now, slip disc, that's a common phrase, but obviously, we know that discs do not slip. They don't slip and slide. They may, kind of bulge or herniate or do different things, but they don't slip. Day 5, so it's still in the acute phase, possibly moving toward that subacute. So this is why things can be a little bit more constant at this stage. So some of the symptoms, now we need more information, but hurts to cough, transition to standing. That's a big one. So when you feel like when you're forward, either sitting or maybe when you're lying first thing in the morning, when you transition or rise from sitting to standing and that piece of disc is taking up space it doesn't belong in, you're trying to get your spine up into straight and it just won't. You feel very stuck and obstructed to movement. The hurts to cough is a very classic and positive sign of a disc injury because of the internal pressure. Coughing like that will often increase pain. So then, of course, we want, hey, any tips? What should I do? How do I fix this? The first thing we want to work on is sitting posture. So with sitting, obviously the bending hurts a little bit probably, and the rising. So anything we can do to put a little bit of increased curve in that lower back and sit taller will then allow the transition to rising to be easy. The second thing will be to try to work into extension. So think of this as lying down. I'm on my stomach, hands under the shoulders, hips and stomach relaxed. Try to press the chest and shoulders up and come back down. So slowly work into extension to reverse that piece of tissue that's in the way. We want to try to move it out of the way so that there's no longer that disc bulge taking up space it doesn't belong in. And third, we'll try to be just as active as you can in general. So walking, try to be up, try to avoid long-term bed rest or inactivity. Hey, I hope those tips helped you. And if you have if you want a more structured plan and need a little bit more help with this, to first, one, fix the disc problem, then two, return to function exercises and get yourself feeling more confident and having less fear about re-injury, message me directly and we'll get on a call and I'll show you how to do it.